My name is Gulum Khandaker. I'm a public health physician and Director of Public Health for Central Queensland Hospital and Health Services. I practice in Rockhampton, so my jurisdiction is Central Queensland Hospital and Health Service and also Central West. Overall, as a public health physician, I cover 23% of Queensland. Rural and regional Queensland has a lot of positive things or good things to offer. As a clinician, as a public health physician, I practice medicine which is rewarding in a rural population. So in general, the rural populations, particularly in Queensland, are very resilient. They're very respectful of health professionals. And also in terms of disease and challenges we are faced in our day-to-day practice are also very different and unique. Central Queensland is a subtropical area, so we see a different pattern of both infectious and non-infectious diseases in the region. The reason actually I chose public health, it has a good mix of both clinical practice and preventative medicine as well. You can make impactful changes overall, and in public health, your patient is not an individual person, rather a bigger part of the community or the whole of the community. In Australia, we just have over 200 public health physicians in the whole country. If you compare that to general practitioners or general physicians, so in Australia there is one general physician for 17,000 Australians compared to one public health physician for 70,000 Australians. So there's a great need for public health physicians in Australia. And particularly COVID-19 pandemic have shown us actually how important the role of public health physicians in this country. And particularly if you want to be a chief health officer in someday, consider public health, because all the chief health officers are public health physicians in this country. It was a choice for many different reasons. Number one, opportunity, and also lifestyle choice as well. So compared to a metropolitan city where I used to practice, I have to drive 2 hours to work every day, where actually in Rockhampton probably I just spend 15 minutes to and from work. So that additional hours actually is for me, or to do other things like to pursue my hobbies or to give time to my family. So in general, actually the quality of life is much better here. You have all the amenities are close to you. Central Queensland actually a wonderful place, particularly Rockhampton. You have a bit of everything very close to you. You have the river where you can go for fishing. You have the Mount Archer, the mountain ranges. You have Capricorn Coast, Yeppoon, and an island which is not far from you, a 20 minutes ferry ride from the coast of Yeppoon. So I think you get kind of best of everything in a small area. I think it's a good balance. Central Queensland is a great place to get trained in any specialty you would like. This area has great potential and great opportunities to offer. It's a great welcoming part of Australia. So consider Central Queensland as your destination. So if you want a bit of change and if you want a quality of life, please consider Central Queensland as your destination.